a new year. It's a time when many of us just pause, reset, and also set our priorities. And one thing you may be focusing on is self-care. So today we're diving in to one of the simplest ways to take care of yourself, staying on top of your preventative health care, and of course, that includes breast health. Joining us now is Dr. Sonya Bhole, a breast radiologist at Northwestern Medicine. Thanks for being with us.
Thank you so much for having me.
Such an important conversation because
Absolutely.
we always talk about women that need to start mammograms in their 40s.
Yep.
But your breast journey should actually start earlier than that. When do you want people to start thinking about their breast health?
This is such an important question, and I kind of want to start by two key messages I really want people out there watching to remember. Number one, breast cancer is not just a disease of older women, and number two, breast cancer is not just a disease in women that have a family history. Yes, absolutely. Starting screening mammogram at age 40 and doing it every year is the way we save the most lives when people are continuously getting their mammograms at age 40. However, your breast journey does start, and it actually can start in your 20s. The American College of Radiology and the Society of Breast Imaging recommend all women get breast risk assessment by the age of 25.
And speaking of that, let's address knowing your risk.
Yeah.
What does that mean, and how do you figure that out?
It's a great question. So knowing your risk means what is your personalized, understanding what your personalized risk of breast cancer is. And you can do that by talking to your doctor and using risk calculators and modules that are available. The most common is the Tyrer-Cuzick model. It takes into consideration, yes, of course, family history, what are your genetics, but also what is your breast density, what is your reproductive history, etc. Like, what are your lifestyle factors? So it takes in all of these considerations, and it gives you a lifetime risk of breast cancer. Those over 20% are considered high risk, and we can use this to personalize your screening regimen, possibly by screening mammograms before the age of 40, and maybe adding in supplemental screening such as MRI.
All right, that's really good to know. And when you're going to your OBGYN appointment, this is so difficult sometimes when you're there and you just don't know what to ask. What should you be asking to maybe get ahead a little bit and stay ahead?
Yeah, so your OBGYN or your primary care, your annual appointment is a perfect time to get really ahead of your breast health. And I always say write it down. I forget my own questions when I go into my doctor's office. So I think, you know, the questions I would do is ask about your risk assessment if you haven't been done. Ask to make sure your family history is updated. Ask about your breast density if you've been getting mammograms. Look at that report with your doctor. Ask if you should get supplemental screening. And I think this is one of the most important. Ask about any orders you might need for the year so that you are ahead of the game.
All right, great tips and especially specific questions that we can write down. I want to talk about prevention because you know that's a key part of breast health. So what are some habits that people can start thinking about now that we're in 2026 for their breast health that you can build?
Well, it's really incredible. Some of the most powerful preventative steps are things that you can just add into your everyday habits. So I'm going to give you 3 things I think you should add into your New Year's resolution.
Okay.
Number 1, risk assessment. We've been talking about it. It's so important. Add that in. Number 2, take realistic preventative steps throughout the year. So eat healthy, be physical, limit your alcohol. And number 3, stay on top of preventative health examinations.
All right, that's so important as we start in January. We're setting our schedule. Thank you so much for all these tips and just things that we should be thinking about this year.
Thank you so much for having me.
Yeah, Dr. Sonya Bhole from Northwestern, we appreciate you. And we do want to note that there are many risk assessment tools out there, but you can find one right now on Northwestern Medicine's website. And we'll be right back.